Tell me about your darkest thoughts. That's what she typed into her phone at 2 a.m. on a Tuesday. Sarah, not her real name, was struggling anxiety, depression, thoughts she couldn't share with anyone. So she downloaded a mental health app. It had 4.8 stars, millions of downloads. It promised complete confidentiality. She told it everything. Her fears about her marriage, her past trauma, the medication she was taking, things she'd never told her own family. 3 weeks later, she started seeing ads for divorce lawyers, then fertility clinics, then crisis hotlines. How did they know? Because the app she trusted with her deepest pain wasn't just listening, it was selling. And Sarah's story, it's happening to millions of people right now, maybe even you. This is the story of how the mental health crisis became the perfect business opportunity, and why your therapy sessions might not be as private as you think. Let's rewind. The world locks down. Anxiety and depression rates double almost overnight. Therapists are booked for months, hotlines are overwhelmed, and then an answer arrives. Mental health apps, thousands of them flood the app stores. Names like BetterHelp, Talkspace, Cerebral, Woebot, Wysa. They promise 24/7 AI therapy, licensed counselors at your fingertips, total privacy, a fraction of the cost. By 2023, over 10,000 mental health apps exist worldwide. They've been downloaded over 200 million times. The mental health app industry, worth nearly $5 billion. But here's what most users don't know. When you click I agree on those terms and conditions, you're not just getting therapy, you're giving away data. Lots of it. And some of these apps, they're not bound by the same privacy laws as your real therapist. Which raises one terrifying question. If they're not protecting your secrets, what are they doing with them? To understand how we got here, we need to go back. The United States passes HIPAA, the Health Insurance Portability and Accountability Act. It's supposed to protect your medical information. If you see a therapist, a doctor, a psychiatrist, they cannot share what you tell them without your explicit consent. Break that rule, massive fines, even jail time. But here's the loophole. HIPAA was written in 1996. The iPhone was invented in 2007. HIPAA covers covered entities, hospitals, clinics, healthcare providers. But many mental health apps, they don't classify themselves as healthcare providers. They're wellness platforms, coaching services, peer support communities, which means they don't have to follow HIPAA, and most users have no idea. February 2022, a bombshell investigation drops. A non-profit called Privacy International and researchers at Duke University start digging into mental health apps. What they find is shocking. They test 37 popular mental health apps. Here's what 29 of them were doing: sharing data with Facebook, sending information to Google, tracking user behavior and selling it to third-party advertisers. Let's talk about BetterHelp, one of the biggest names in online therapy. Over 3 million users, endorsed by celebrities, YouTube sponsors, podcasters. When you sign up, they ask detailed questions. Have you experienced trauma? Are you having suicidal thoughts? What medications are you on? Do you have relationship problems? Sensitive, personal, private, or so you'd think. March 2023, the Federal Trade Commission hits BetterHelp with a bombshell ruling. They shared users' health data with Facebook, Snapchat, and other advertisers for targeting purposes. They used email addresses to match users with their social media profiles. They promised confidentiality, then broke it. BetterHelp was fined $7.8 million, but the damage was already done. Millions of people's mental health information out there. And BetterHelp wasn't alone. Meet Cerebral, a telehealth app for ADHD and anxiety treatment, funded with hundreds of millions in venture capital. Grew explosively during the pandemic. But behind the scenes, former employees would later reveal the company had a quota system. Clinicians were pressured to prescribe medication fast. Why? Because prescriptions meant retention. Retention meant data. Data meant growth. Growth meant profit. In 2023, Cerebral confirmed they had shared sensitive health data, including prescription information, with advertisers and third parties, and the list goes on. Talkspace, Ginger, Mindshift, HIPAA, one investigation after another. But this was only the beginning, because the real nightmare isn't just who gets your data, it's what they do with it. Let's say you're struggling. You download a mental health app. You're honest, vulnerable. You share things you've never said out loud. Here's what happens next. Behind the screen. Step 1. Data extraction. Everything you type is collected. Keywords, session length, time of day you use the app, Emotional tone analyzed by AI. Topics discussed. Some apps even request access to your microphone, your location, your contacts, your photo library. Step 2. The tracking pixel. Buried in the app's code is something called a tracking pixel, a tiny piece of code from Facebook, Google, TikTok. When you use the app, it fires. It sends a signal. User opened app. User completed intake form. User mentioned depression, anxiety, trauma. That signal gets matched to your device ID, and if you've ever logged into Facebook or Google on that device, now they know it's you. Step 3. The auction. Your data enters what's called a real-time bidding system. Advertisers bid to show you ads based on your mental health profile. You mentioned anxiety? Here come ads for CBD gummies, self-help books, expensive retreats. You talked about divorce, lawyers, mediators, dating apps, and it gets darker. Step 4. The life insurance problem. Here's what most people don't realize. Some data brokers collect mental health information and sell it in bulk. Who's buying? Insurance companies, employers running background checks, even landlords. There are documented cases of people being denied life insurance after using a depression app. Questioned during job interviews about therapy mentions online. Flagged as high risk in background screenings. Your mental health data can follow you for life. But wait, you might say, don't they ask permission? Technically, yes. It's buried in the terms of service. That thing nobody reads. Section 12, subsection D, paragraph 4. We may share anonymized data with third-party partners for analytics and advertising purposes. Sounds harmless, right? Wrong. A 2019 study found that so-called anonymized data can be re-identified 99.98% of the time. All it takes is 3 data points: your zip code, your birth date, your gender. Combine that with app usage patterns, and you're no longer anonymous. You're you, and once your data is sold, you can't take it back. Now here's where it gets global, because this isn't just happening in the US. Mental health apps operate worldwide, but privacy laws, they're a patchwork. Europe has GDPR, strict data rules, but enforcement is slow. In countries like India, Brazil, Kenya, regulations are weak or non-existent. Investigations in the UK, Canada, and Australia have all found the same thing. Mental health apps are harvesting data, sharing it, profiting from pain, and the most vulnerable users, people in crisis, are the least likely to read the fine print. But just when you think it can't get worse, it does. Enter the AI therapists. In 2023, apps like Woebot, Wysa, and Replika explode in popularity. They're not human therapists, they're AI chatbots, powered by machine learning, available 24/7, and millions of people, especially young people, are talking to them. For many, they're a lifeline, affordable, judgment-free, instant. But here's the problem. Every conversation you have with an AI therapist, it's training data. The AI learns from you, your words, your emotions, your patterns, and that data, it's stored, often indefinitely. In 2024, Mozilla Foundation published a massive investigation. They reviewed 32 AI mental health apps. Their finding, every single one had concerning privacy practices. Many didn't encrypt messages. Some stored chat logs on insecure servers. Others openly stated they could use your conversations to improve algorithms, which often means selling insights to third parties. Take Replika, an AI companion app with over 10 million users. People formed deep emotional bonds with their AI, shared trauma, secrets, fears. Then, reports surfaced. User data, including intimate conversations, was accessible to employees. Some conversations were even reviewed by human moderators, without users knowing. The trust was broken, but millions kept using it because they had no other option. January 2024, a landmark case begins in California. A woman sues a mental health app after her therapy data appeared in a data breach. Her conversations about domestic abuse were leaked online. Her abuser found them. The app's defense: she agreed to the terms of service. This case is still ongoing, but it's a wake-up call, because it proves something terrifying. Your secrets are only as safe as the weakest link in a company's security or ethics, and right now, there are thousands of weak links. So what does all this mean? Not just for individuals, but for society. First, the chilling effect. When people learn their therapy isn't private, they stop being honest, they hold back, they don't get the help they need. Studies show that privacy concerns are now one of the top reasons people avoid mental health care. We're in a mental health crisis, and fear of surveillance is making it worse. Second, discrimination. Imagine applying for a job. You're qualified, experienced, but the company runs a background check through a data broker, and that broker has a record. User of depression-related app, high engagement during work hours. You don't get the job. You never know why. This is already happening. Third, government surveillance. In some countries, mental health data is a weapon. Activists, journalists, dissidents. If a government can access therapy records, they can predict behavior, manipulate individuals, discredit opponents. Researchers have found evidence that some governments are buying bulk mental health data from international app companies. Your therapy session in New York could end up in a database in Beijing. Fourth, the youth crisis. Teens and young adults are the biggest users of mental health apps. They're also the least aware of privacy risks. Imagine a 15-year-old struggling with self-harm. She uses a free app, shares everything. That data gets sold. Years later, she applies to college, a third-party service. Flags her as high risk. Her future, shaped by an algorithm, based on her darkest moment. The backlash is building. Lawmakers in the US, EU, and UK are drafting new regulations. Some want to classify all mental health apps as healthcare providers, forcing them under HIPAA-like rules. Others want to ban data sharing entirely. Privacy advocates are fighting back, but the industry is worth billions, and it's lobbying hard. The question is, will change come fast enough? So what happens next? There are three possible futures. Scenario 1. The regulatory crackdown. Government step in. New laws force mental health apps to encrypt all data end-to-end, delete conversations after sessions, ban all third-party data sharing, face HIPAA-level penalties for violations. Apps that can't comply, shut down. The good, your data is protected. The bad, many free apps disappear. Mental health care becomes less accessible. Scenario 2. The privacy revolution. A new generation of apps emerges, built on privacy-first technology. Zero data collection, open source code, fully encrypted, locally stored conversations. No ads, no tracking, just care. Some already exist. Apps like Signal Therapy, Mind Ease, and others are leading the way. The good, trust is rebuilt. The bad, they're harder to scale. Fewer people know about them. Scenario 3. The surveillance spiral. Nothing changes. Regulations stall. The mental health app industry keeps growing. Data selling becomes normalized. Your therapy data merges with your shopping habits, your social media, your location history, your biometric data from wearables. AI builds a complete psychological profile of you. Corporations know you better than you know yourself, and they sell that knowledge to the highest bidder. This is the future we're currently headed toward, unless we act. Remember Sarah? After she discovered what happened to her data, she deleted the app. She filed complaints. She warned her friends. But her data, it's still out there, being passed from server to server, bought and sold. Because here's the truth. Mental health apps promise to heal us, but somewhere along the way, they started profiting from our pain. Your therapy should be a safe space, not a data mine. If you use a mental health app, check the privacy policy. Look for end-to-end encryption. Avoid apps that share data with advertisers. And remember, just because something is free doesn't mean it's not costing you. Protect your mind, protect your data.